Welcome, everyone. My name is Dave Myers. I'm with the Berks Alliance, and we're very pleased to be hosting this program today. Thank you for joining us in the middle of the summer on a beautiful day. I'm going to turn it over quickly to John Weidenhammer, who is the chair of the Berks Alliance, for some brief comments.
So hi, everybody. Assuming you've been on for a while, you've already heard me talking, but I just want to start by thanking Dave, who, as normal, has done a super job in organizing this presentation today. And I also want to thank our team of panelists and presenters for them taking the time to prepare for and present to all of us today. Some of you probably know that I am one of the board members at Centro and have been very involved in this project. And I just can't begin to tell the community how pleased I am with the work that we're doing. Violet and others will tell you more specifically about the work that we're doing. But essentially what Centro is about is we're trying to take unskilled and underskilled and underemployed individuals in our community and give them the skills that they need to move into higher and better levels of employment in the community. And so far, we're doing just a really fabulous job of that. And I think you're going to hear some success stories today that underscore really the great work that Centro is doing. And I'm just thrilled with the leadership that's being provided by the team. Of course, Violet is our executive director and leads that, but there is really good work being done here. And so far, in a relatively short period of time that we've been operating, we've been transforming lives through the work that we're doing. And I'm really proud of the work, and I think the future is very bright for this organization. So Dave, I'll turn it back to you.
Thank you, John. Yeah, I think this is going to be a very interesting discussion today. The Latino Workforce Development Corporation and Centro are tremendous new assets to the community. I'm going to cover some quick ground rules for everybody. We're going to ask you to keep your camera on because it's always good to see living people. But to mute your microphone, we're going to ask you to use the chat function at the bottom to submit your comments and questions. We'll get to those at the end of the formal presentation. We will collect all those. I will either ask the questions and share the comments, or I will call on the person who submitted them to do that. We will record this and share it with everybody who is registered for the event. We have people who register but aren't able to make it, and we understand that with summer vacation time that's a likely activity happening right now. But we share it with them by sending it to them, and we also post it on the Berks Alliance website, and we share it with our friends at BCTV, so it gets displayed fairly widely. With that, I am going to turn the program over to Violet Emery. Violet is the executive director of the Berks Latino Workforce Development Corporation and Centro Reading. And Violet, it's to you.
Thank you, Dave. I want to thank you and John for having us and giving us the opportunity to share the work that's being done at Centro Berks. Today, I have my team, which none of this work can be done without the individuals that are going to be presenting today. We're going to be sharing with you some of the services and what the work that is being done at Centro Berks. You're going to hear about our adult education programs, our allied health programs, our employment services, and a little bit about the work that we're doing in the community and the impact of our work. I will share some stories, as John mentioned, of some of the success stories of our students who have completed our training tracks and the impact that their earning capacity has changed their lives. Today, I'm going to talk a little bit, I'm going to mention the agenda. I'm going to talk a little bit about Centro Berks, just a background and some of the services that we provide. Allied health programs are going to be covered by Gidari Miranda, who is our program supervisor. Our employment services are going to be discussed by Kimberly Irizarry, who is our employment specialist, and Sally's going to offer our numbers and how our impact in the community. And Sally is our operations director. And as I said, I cannot do this work alone, and their work that they do every day and come in here and give it their all. I appreciate them. So a little bit about Tech Central. With the seed money, thanks to the Why Missing Foundation and the support of local leaders and entrepreneurs who recognize the need for workforce development in Berks County, Tech Central was incorporated in 2019, modeled after Tech Central Lancaster, who has been doing workforce development successfully in Lancaster for many years. Carlos Corbera came in, worked with the leadership team and the entrepreneurs from Berks County to bring Tech Central to Berks. We acquired our current space where, as John mentioned, we're in an old parochial school at 450 South 6th Street. The building, like I always say, has good bones, but we're working on improvements that are necessary for us to be able to phase in other training tracks. So we're in the process of doing that. And so we're continuing to grow. We're continuing to, focus on growing the organization, but also keeping at the forefront that we want to offer effective quality training to the students that come through our doors. Of course, we want our graduates to be able to gain employment, and which will lead to long-term sustainability, and we're here to guide them along the way. One of the things that I'm proud to say that Tech Central Berks does really well is our case management. We offer support to students from the minute that they start their program until a year after they graduate our program. So we work with them with any life stressors that come their way. And so one of the things, again, as we do really well is our case management, and we are going to continue to offer that service because we understand it's important for our students to get through the training that we offer. So next screen. A little bit of background about the numbers that we have here in Berks County. As we know, Reading is the largest urban area in Pennsylvania, has a population of approximately about 96 individuals. Our focus at Tech Central Berks is on the Latino community. As we know, our numbers are 68% of the residents of Reading are Latino. And even though our focus is on the Latino community, our services are all inclusive. Anybody that comes to the door wants to participate in services or needs assistance, we are here to help them. Within the last 2 decades, the city of Reading has consistently ranked in yearly national studies as among the poorest cities in the United States. I say that to say that those numbers do not reflect the character of the residents of Berks County, the residents that come through our doors every day. Even though over 36% of the city's population live under the federal poverty scale, and the unemployment being 4.4%, the relatively low unemployment rate compared to the high poverty levels leads to a problem of severe underemployment. And that's what Tech Central Berks is focused on, is filling that gap. Next screen. Our services. I'm going to talk a little bit more about our services in detail, but currently we're offering adult basic education, occupational training programs, again, case management, employment services, and translation services. So if you can look at the screen, these are the lists of the programs that we're currently offering or that will be phased in the near future. I'm going to start talking about our adult basic education program. We started our programs in September of 2021 with offering English as a second language. It's the first program that Tech Central Berks phased in. It's the program that has the greatest need. Currently, we have about 196 individuals on our wait list. And so our students partnered with the Literacy Council. We offer ESL programs here at Berks, at Tech Central Berks. We offer various levels, beginner, intermediate, and conversational English. We recognize the need to phase in a Saturday program with ESL. And so we currently offer ESL programs here at Tech Central Berks 5 days a week. Moving on to our IBM platform. This is another platform that we offer our students. This is a digital training, virtual training program. Anybody interested in gaining insight into a training track that's offered on the platform, there's various training tracks that individuals can take. One of the nice feature of this training is that they're self-paced. Individuals can do them at home anytime they have time. There's no time that they have to sit in front of a screen to complete these training tracks. They are free to work as they see fit and as time permits. And one of the things that we've seen with this platform are individuals who are really looking to increase their IT skills or enter the IT field, have taken advantage of the IBM program. So that's one of the things that we are happy that we can offer to our students who cannot come into a traditional classroom, but want to learn and gain some insight into a skill. Digital literacy. This is one of the things that we've seen a great need for. We currently have a waiting list for our digital literacy program also. We're lucky enough to have a grant from the Department of Labor and Industry to offer a digital literacy component as part of our training tracks with our allied health program. Our first allied health program, which was the CNA program, we realized that there were students who struggled with technology, and we needed to address that before we started our second CNA cohort. And doing that, we offered, as part of our orientation, digital literacy workshop where students were trained on how to basic computer skills and how to navigate the RAC platform, which is Canvas. Since RAC is our vendor for our allied health programs, we wanted to make sure that our students were prepared to enter the training track and not have digital literacy as a barrier for them to complete their training. It was beneficial to do that. Students were prepared to enter their training track without having, without dealing with the barrier of digital literacy. They can at least navigate their computers, laptops, and the platform that they needed to navigate for their training. Financial literacy. We are partnered with the neighborhood housing services who come in and do workshops with our current ESL students. One of the things that we focus on, we have students here who really want to either purchase a home or they want to cover budgeting and just financial management overall. We offer them this workshop as part of their English as a second language training. We hope to phase that training, that financial literacy piece in all our training tracks. We're trying to navigate the scheduling of that where time permits so that our students can actually, get some information on, financial literacy and budgeting and once they graduate from our programs, how to manage their household budget to be able to cover their expenses and have some background in doing that. I want to thank our partners. Again, I always go back to, we cannot do this work alone. I want to thank RAC, who does our allied health program, who is our partner, who has been our partner since day one with those programs. I also want to thank Literacy Council, who works with our ESL students, who is a great partner to Tech Central Berks. I also want to mention Centro, who we just recently entered into an agreement with them to do some case management for our allied health. We're also talking with Centro about our culinary arts program. I also want to mention two other organizations that are not on here. I want to thank Berks Connections, talking with Peggy and her team about bringing a cognitive behavior piece component to our training tracks. We understand that that is a need, and we want to make sure that we address that need with our students, that our students are well prepared when they enter the work field. I also want to mention iLead, with who has been really, really supportive in our HiSET training programs that we offer here at Tech Central, and we utilize their site for our HiSET training. So those are the few of the organizations that I wanted to mention, and everybody else who has supported Tech Central along the way. So I'm gonna hand it over to Hidari Miranda, who's going to talk about our allied health programs.
Good afternoon. I'm Kidari Miranda, Program Supervisor at Berks Latino. My primary role is oversee the early health programs. We offer this program for free to all Berks County citizens who are 18 years old or above. Our programs aim to improve the quality of life of our community, allowing them to achieve a stable economic income and a better education. We currently have 2 active programs, nurse aid and phlebotomy. We plan to add medical assistant in the future. We partner with Reading Area Community College, also known as RAC, as a vendor to provide instructor and certification for our programs. Also, we partner with the Spanish Center, which help us with the case management and enrollment process for the nurse aid program. Moreover, a student participating in the SNAP program can enroll in the reimbursement program, which covers expenses such as uniform, materials, and transportation. In addition, we provide a student with the white cloth uniform for the graduation day. Telling you more detail about our program, the Nurse Aid program provides the student with the basic nursing skill to care of patients and residents in a long-term facility or hospital. This program lasts 12 weeks and covers medical terminology 1 and 2, workplace success, nurse aid training, and 9 days of clinical internship. After finishing the program, a student must pass a skill and writing test called the National Nurse Aid Assessment Program Test to be registered in the Pennsylvania Register of Nursing Aid. This program allows the student to earn a salary ranging from $19 to $30 per hour. We already serve 3 cohort of the students, 16 graduate and work in the nurse aid field, earning wage ranging from $22 to $30 per hour. Another 10 are about to graduate this July 13th. We now have a waiting list of 43 participants who are hoping to start the next nurse aid program that will start in June 26th. And the next one will start in September of this year. The requirements to enroll on the nurse aid program are a English proficiency test called API. This test is required to enroll in the program. If the participants do not pass the test, we offer them the opportunity to enroll in our English as a second language program. We offer different levels in the English as a second language program. These levels are basic, intermediate, and conversational English. The participants are organized into the level based on their English proficiency test results. They will need a copy of Pennsylvania State ID. This must be valid and not expired. Proof of medical insurance. Without it, a student will not be able to participate in the program. Pennsylvania background clearance. FBI for those who not live in the Pennsylvania for the past 2 years. Our intake privacy statement photo release. They need the Reading Area Community College Nurse Aid Program Health Examination, the online application from RAC, Pennsylvania Verification of Residence, and Pennsylvania Attestation of Compliance. Also, they will need the copy of COVID-19 vaccination and the flu shot. Telling you more about the phlebotomy program. The phlebotomy program prepares students to collect client blood specimens through venous puncture and capillary sampling for the lab analysis. A student will become familiar with all aspects of blood collection and develop comprehensive skills to perform venous puncture truly and safely. The phlebotomy program lasts 15 weeks and covers medical terminology 1 and 2, workplace success, healthcare skills, phlebotomy 1 and 2, CPR certification, and 80 hours of internship. This program allows students to earn a salary from $16 to $25 per hour. We already serve one cohort of 10 students who 9 are set to graduate on Friday, June 23. Also, we had a 20 individuals waiting to start the next program starting this September. The requirements to enroll in the phlebotomy program are API English test. As I mentioned earlier, if the participants do not pass the test, we offer the opportunity to enroll in the ESL program. They will need a high school diploma or GED to participate in the program. However, if any of the participants do not have one, we provide the option to enroll in our HiSET program. This program prepares the student to the high school equivalent test and help them to earn the high school diploma. A copy of the Pennsylvania State ID had to be valid, proof of medical insurance, Pennsylvania background clearance, FBI clearance, or intake, privacy statement, and photo release. Also, they will fill out their Reading Area Community College online application, a copy of the COVID-19 vaccination card, and the flu shot. We understand the importance of case management in helping our participants to reach their goals during and after this program. For this reason, we provide each student with a full year of case management upon completing any program. This ensures the students have all the necessary resources to reach their goals. We also honor our student achievement, hosting a lovely graduation ceremony. This ceremony occurs at our site and allows students to invite their loved ones. On the graduation day, we hold a mini job fair with employers in the field afterward. We aim to help our students receive a reasonable job offer, paving the way for a bright future. Some of our medical field employer partners are NGW Conform, Angela K. Home Care, Caregiver America, Coravia Home Health Care, Maxima Staffing, Moravia Health, Open System, Patriot Home Care, Pennsylvania State Hospital, St. Joseph's Hospital, the Highland at the Wyomissing, Silence Group, Tower Health, U.S. Medical Staffing, and the Wyomissing Health and Rehab. As previously mentioned by my executive director, we will offering trade program in culinary art, commercial and industrial electrician, and plumbing, in addition to our health programs. Thank you for your attention. I want to introduce my coworker, Kimberly Irizarry, the employment specialist. She will provide you more information about the employment services.
Good afternoon, everyone. My name is Kimberly Irizarry, as Kidari said. I'm the employment specialist from Berks Latino Workforce Development Corporation, Centro. And my main goal as employment specialist is help everyone to come to my desk to get a job or any other resources that we can bring to them. And telling you more about employment services, we require work authorization in the United States, and the participant will need to provide us copy of the ID of the state or any other work authorization ID that they have. Once we provide or receive the ID, we move forward with the participant assessment. And we assess the needs, strengths, and goals resumes, and gather information of the individual's skills, education, work history, and career aspirations. And that way we can refer them and connect with clients, with employers, partners, and that way they can assist the client in finding suitable job opportunities aligned with their skills and career goals. We also help with job opportunities aligned with their skills and preparation, and we networking strategies. Additionally, they may work together to facilitate the client's successful entry into the workforce. And for support and advocacy, I work through with them in the process, and I provide to them ongoing support and guidance to the clients. And they may offer counseling and mentorship or in the career coaching to help individuals overcome challenges and stay motivated. They also serve as advocates for their clients, helping them navigate workplaces issues and negotiate job offers or assess necessary accommodations. We do case management in base the intake, needs assessment, service planning, and monitoring and evaluation, and notes. I monitor clients' progress toward their goals and track their outcomes. They need to maintain regular contact to ensure the clients are on track and address any obstacle or adjustment that they need in the action plan. I do documentation and reporting. That helped me to maintain accurate and up-to-date records of client interactions and the services provided and outcomes achieved. They may need responsible for generating reports to demonstrate the impact of their programs, including statistical data, success stories, and qualitative feedback from clients. Inside case management, we have the retention. I provide a retention period of 30, 60 to 90 days to establish strength and weakness of the client for further help if needed. For us, it's really important to create a bond or relationship where our clients achieve their goals. We also do job fairs. We host quarterly. In our side job fairs, we invite our employees partnerships to participate in our job fairs. And that way we can offer to the new participant and current job seekers to meet the employer in person and talk about open positions and benefits that they can offer to them. We also participate in job fairs and outreach community as a vendor, and that way we can establish new partnerships and better benefits for our clients. Next, please. We provide for the participant assistance, complete an online application or in-person application. The way that they need assistance with any application, we can help them out. I also assist building strong resumes so that way they can have any better opportunity of job employment. And I provide advices about the interview process to help them to be successful in the interview process with the employer. And for partners, we provide to our partners, employees, qualified candidates, free promotion and job postings, and translation services, everything for free. We have around 60 partnerships in manufacturing, warehouses, in clericals, and home care. And to conclude, my role as employment specialist, besides guide and empower individuals in their employment and professional journey, is help clients overcome barriers, assess resources, and develop the skill needed to succeed in the workforce, ultimately improving the economic stability and quality of their life. Thank you so much for your attention. And now I would like to introduce our Operation Director, Sally Blondet.
Valerie,
Thank
might
you,
be on mute.
Kimberly. Thanks,
There you go.
Kimberly. Hi, everyone. My name is Sally Blondet. I am the operations director here in Tech Centro Berks. My role is overseeing and managing the day-to-day operations. This means monitoring the program attendance, supervising the employees, support the teachers and specialist programs and case managers, and designing, implementing, and evaluating internal initiative. I also manage our internal data and assist our executive director in developing and implementing the organization's programs, strategic goals, and objectives. Now, I would like to share with you some important information about our outcomes and impact. Let's start with the years 2021 and 2022. Here is our impact report for both years. And overall, we served 634 individuals. That means we complete that amount of intake, enrolling people for our services. For the general, we serve 941 participants enrolled for our services. This is because we have the same students sometimes enrolled in different services. On the other hand, talking about our workforce programs, we serve 18 participants enrolled in our workforce training, especially in the CNA program, with a graduation rate of 100%. And we serve 264 enrolled in our employment services, and 148 of them got a job, with an average wage of $18 per hour. Regarding our adult basic education, 165 individuals participating in our ESL classes. We can say that 104 of participants receive credentials, which means are considered graduates for our ESL and CNA. Regarding our impact for 2023, as today, we have served 385 individuals and 431 are enrolled for our services. Regarding the workforce program, 30 participants were enrolled in CNA and 10 in the phlebotomy program. So far, with 90% of graduation rate. Regarding employment services, 107 received employment services and 45 of them gained a job with $20 average wage rate per hour. About our adult basic education program, we serve 217 participants, 250 of them for ESL, and the other 16 for HISET. We can say that 72 of our participants receive credentials. That means are considered graduates for our programs in the ESL and CNA. Regarding our summary for our education and adult basic education, we have ESL, IBM, computer classes, and HISET. As of today, we offer 6 cohorts for ESL, which means we serve 421 participants. We are very proud to say that it has impacted the life of hundreds of individuals, helping them to establish basic communications, for example, doctor appointments, employment interviews, ordering at a restaurant, or just helping their children with their assignments. About IBM, 120 individuals were allowed to take professional training free of cost at their own pace. In the last quarter of 2022, we offered our first computer class, and the first quarter of 2023, we offered our second computer class. In both classes, we served 16 students in our both high set cohort held this year. We served 16 students as well. Next slide, we have a summary of enrollment for our allied health programs for 2022 as today. We held a 3 CNA cohort, 27 individuals served, and 16 of them graduate. The remaining 10 are currently taking classes, and they will be graduating on July of this year. Regarding phlebotomy, we just held one cohort where we served 10 participants. 9 of them will be graduating next Friday, the 23rd. And we are very proud for that too. You are invited to participate in both graduations, phlebotomy next Friday at 1 o'clock and CNA on July 13th. Last summary is about our employment services. Since 2021, we have served 375 individuals, and over 100 of them are employed. We have 9 job fairs, and our site with over 400 participants. 68 of them got a job. We collaborate about 60 employers in different industries like manufacturing, farming, warehouse, health, non-profit organizations, and professionals, employers to make referrals to our employment services. Regarding our waiting list, we would like to speak about that. At the top of our waiting list program, we have ESL classes with almost 200 potential participants. Second, we have digital literacy with 57 individuals interested. In July, we plan to have Microsoft Office and Google Workplace in September. Next, we have CNA. We have the number of allied health, CNA, and phlebotomy. Regarding CNA, we have 45, and including the participants enrolled in our next cohort that start in June 26, and the other that are in our list for September session, and the potential participant list. Regarding medical assistant, we plan to do the first cohort on 2024, hopefully, and we have 24 individuals interested in phlebotomy. Medical assistant, we have 32. We have 10 enrolled for our next cohort that will be in September. Next, we have construction and plumbing with 13 and 12 respectively, and we plan to have both 3 programs in 2024. And finally, we have our upcoming culinary arts program, which will be offered in September, and we have 11 individuals on the waiting list for that program. Thank you for your attention. Now we will have our Executive Director, Violet Emory, speaking about some successful stories.
Thank you. Sally, can you go back to, is it the previous slide with the 3 students? Or is it the next? It's following. I'll talk a little bit about Priscilla. Priscilla entered our program. She had 2 small children at home, wasn't sure if she was really ready to enter the CNA program. She came in, took the test, the API test, scored really well, still was apprehensive about entering the program. She had not really wanted to get out of the house, really wanted to contribute to the household, and came through the doors at Tech Central Berks, gave us a call and said, I'm ready to go. So Priscilla came in, excelled at her CNA training. She was not working at the time. She had a small child at home, which she had to navigate with scheduling her husband work hours so that she can come to class during the day, and her husband can watch the child while he changed his schedule to work second shift. Priscilla was one of our first students who graduated. She graduated with our first cohort, is now currently employed, has her state certification, and is currently working at the Highlands of Wyomissing, making $30 an hour per diem. This has been very impactful in her life, just the fact that she can contribute to her household. She earns an income that is a sustainable wage, and is looking into entering a nursing program, and was looking at entering a nursing program at Penn State. So we're proud of Priscilla. And so this is part of why we do the work we do. And so, yeah. Sally, if you can go to the next screen, I can talk about. Okay, here we go. Essence Lewis came into us as a mother of one of our previous graduates in our first cohort of nurse aide. Essence is a mother of 7 children, entered our program, has always worked as a home health care worker. She came in really dealing with a lot of obstacles. Another one who changed her shift. She had a death in her family prior to entering, right a week or two before entering the program. Again, was apprehensive to say, can I do this? She entered the program, never missed a day of class, would work 3rd shift, go home, take her children to school, come to class, and did that and did not miss one class. She is graduated. She has her state certification. She's graduated with our 2nd cohort and is now state certified, and is working as a certified nurse aide. Daphne came to us as relocated to Reading, Pennsylvania from New York, came in here looking for employment opportunities. Also is interested and is on our wait list for our phlebotomy program. In the meantime, she was hired at East Penn Manufacturing, where she has been there for over a year. She just celebrated her 1-year anniversary with them. She plans to continue her employment and enter our training phlebotomy program after she's now pregnant. So that's kind of delayed her entry into the phlebotomy program, but that is her goal, is to enter our program while she continues to maintain and earn a sustainable wage at East Penn Manufacturing. One of the things about Daphne, when she came in and we said, what type of work are you looking for? She said, anything. I'm a hard worker. I want to work. And so she works very hard, and she comes in and checks in every once in a while, and she's doing really well. A little bit about Getzi. Getzi was our ESL student. She came in also a mother of small children. She has a special needs child, but also was looking for employment to be able to contribute to her household. She took a couple semesters of ESL with us and came to us for employment services. We have a partnership with Opportunity House where we recommended and referred her to, which works out for her really well because her children can go to work with her and attend the daycare. She is a daycare assistant at Opportunity House and has just earned her 1-year anniversary there. So, I mean, these success stories is why we do the work we do every day, and the impact that our work has on our students. And we're proud to say that. So I just want to thank everybody for their time. We'll address any questions now. I know we gave a lot of information, but we will address any questions that anybody would have. And one of the things I did forget to mention earlier when I was speaking about our trades programs that we will be phasing in late 2023 or sometime in 2024. Currently, we're working to phase in our culinary arts program, working with another organization in Berks County, Centro. And so we're hoping to have that program phased in by September of 2023. Also, our commercial and industrial plumbing and commercial and industrial electrical and fiber optics are programs that we want to offer in-house. John mentioned that our building requires some capital improvements to be able to do that. We're working on those improvements now and hope to facing those programs sometime in 2024. So we're excited about those programs. It's been a long time coming, but we're working to make sure that, you know, the programs that we phase in are phased in at the right time with the right instructors, you know, just to make sure that the training that we offer for our students is very effective and they get quality training. So, yeah, I just wanted to mention that because I forgot to mention that the first go round.
There's a lot to mention.
Yes.
It's incredible the amount of work you're doing already, and the impact that you're beginning to have, significant impact that you're beginning to have. How many people work for Tech Centro and for the Latino Workforce Development Corporation?
We currently have 9 staff members. The staff members that you see here, we also have instructors that we hired in-house. We have a part-time ESL instructor, we have a part-time HiSET instructor, and then we have some custodial positions that, you know, work in our building.
That's a lot to carry on your shoulders. We had a few questions, and I've got a few questions of my own. One I thought was really interesting. What would you say are the 3 most significant obstacles that the people you work with must overcome? And how do you specifically work to help them address those obstacles?
I think the first one, I would say, is the English proficiency. And of course, we offer English as a second language for any students interested in entering our training tracks who may not be at the level that's necessary for those training tracks. It's not like, oh, if you can't speak English, we can't help you. And you know, with anything, we're going to make sure that we get you to the level of English proficiency that you can enter your training track and be successful. That's number one, I believe. That, you know, as you see, the numbers are the highest with the ESL. Our waiting list is the highest number with ESL, and hence that's why we work with the Literacy Council and our in-house instructor to meet the needs of the students that we have coming through our doors. I think the second obstacle would be life stressors that individuals deal with every day, as we all do. When they come through our programs, they may be dealing with food insecurity, housing insecurity. This past semester, we're dealing with a lot of individuals who are dealing with utility cutoffs and things like that. So I think managing those life stressors is important, that we have relationships with other organizations that can help out in those situations, because we cannot, you know, handle all the things that come through our doors, but we want to make sure that we have resources to do that. One of the other things I want to mention is that we have we are currently going to hire 2 community navigators that will help organizations in the South of Penn in our community to help individuals that come through our doors and the doors of the Salvation Army or the Reading Public Library, who deal with some of these stressors, and we want to be able to assist them in finding resolutions to the issues that they face. So one of the things, thanks to the Wyoming Foundation, who has funded those 2 positions at Tech Central Berks, we'll be able to offer some assistance to the students that come through our doors dealing with these life stressors. I think it's important for us, as I mentioned before, case management is what we do. We do it really well. And so having those 2 community navigators here on site and other sites, I believe we're going to be able to meet the needs of our students much better than what we do now. So those things. Also, I think one of the things that come through our doors, the third would be individuals who have skill sets and have come here from different countries, who are educated, who are professional, or who have some experience in fields that they cannot practice here. One of the things that we see is that a lot of individuals, because of the English proficiency and also that the credentials are not recognized here, they really have to start from the bottom. And so really starting with learning English, number one, and how we can navigate for them to either enter a training track that we offer so that they can maybe stay in the field that they once worked in, or they want to enter a new career. So those are the 3 obstacles I think that we see the most here at Tech Centro. I'll let my staff chime in if I missed anything, but we do our best to address those needs. And if we can't do it in-house, we make sure that we have partners. We have really great partners who have been very supportive of our work, that we get them the needs, get them the help that they need.
And hearing the conversation, the presentations, there are a couple other issues that sort of resonated with me that I wanted to ask about. Mentioned in the IBM program that you provide hotspots and Chromebooks to help people with those. Is internet access a challenge for the people that you deal with?
Yes, there are some. We don't have the resources to allow, we don't have a loaner program. That's something that we're looking into, but currently they have to come in-house and use, if they want to fill out a job application, or if they just want to use the Wi-Fi, they have to come in here and use it in-house. There are individuals, even with our students, who maybe have to come here because they don't have Wi-Fi at home. They can't afford it, or they just don't have the means to have the resource at home or outside of our building. A lot of the technology that's being used is phones. And as we know, everything can't be done by a smartphone. So
Smart, but not that smart.
yeah, I mean, you can do a lot, but there are some challenges. And so I think really it's the resources of having, the technology at home, even the hardware, just affording, we have some CNA students that come in who don't have laptops at home. So they're fortunate enough that we give, that we loan them throughout their training tracks a Chromebook that they can use in the classroom. But there are some struggles and there are some barriers there. Mm-hmm.
Two other ones that I sort of heard in the background were transportation and access to childcare. Are they challenges that your clients are facing, and is there a way to help address that?
Childcare, I should have mentioned that as one of the most significant obstacles. I just was thinking of others, but yes, childcare should be the top of the list there. Childcare for us has been and will continue to be a barrier for some of our students here. One of the things that we mention to our students when they come in, especially to our allied health, because of the attendance restrictions, is that you have to have a backup to the backup to the backup when it comes to childcare. We've unsuccessfully attempted to find a resource that we can send our students to on an immediate need basis and not have to be put on a wait list. That's something that we're talking about, how we can address that in-house here at Tech Centro, but it is a huge barrier. I missed that, and I apologize, but
No,
that is
okay.
one of the things, that our students face every day. And we have been fortunate enough that we prepare our students that are coming in, that have come through our doors, is to make sure that you have somebody to back you up, because you can only miss a day of class of CNA training. And if you miss more than a day, you cannot continue with the program. So you can understand how much pressure our students are under. So they have to have the support and the means in place to be able to get through that program.
So that is a challenge. Is transportation a challenge?
Transportation is a challenge. I mean, initially, I think it's more of a challenge for, not for our training in-house, but for employment. Some students come in and they have to take, public transportation, or they have to take, Uber to get to work until they get their first pay. And so I know that there's other organizations like Berks Connections that may help them in, with some of those challenges or IDs that they need for employment. So again, it is important for us to be able to work with our partner organizations to meet those needs, because we don't do everything, and we can't do everything in-house, but making sure that we have resources for our participants and our students.
Networks. There was a question about the financial literacy program. Is that embedded only in certain specific programs, or do you offer financial literacy training for anybody who wants it, needs it?
Currently, it's only part of our ESL program. We are looking into integrating it into the other training tracks, because of some of our other programs who are time restriction. We can't take too much time away from the instruction. And so we have to kind of navigate that piece of it. But yes, we would like to integrate that into all our training tracks, or offer it something, a standalone training. We're not there yet.
Yet another challenge to face.
Yeah.
You identified a number of the partners that you have, particularly in the private sector. How does somebody go about becoming a partner with you in terms of working with you to employ people to create the programs that you're trying to create to serve those people? If I'm an employer or business, how do I get engaged with you?
Well, it's as simple as contacting us, sit down and have a conversation to see if our missions align. Make sure that if we're working with an employer, we make sure that it is somebody that is going to be beneficial to the students and the services that we provide here. Of course, any of our employer partners, of course, everybody's looking for staff right now.
Desperately.
Right. So, we have to, we can't, help everybody, all the employers that are in need. But yes, anybody that's interested in engaging and learning more about Tech Centro and seeing if we can work together, it's as simple as just giving me a call, and we can sit down and have a conversation to see if it's something that will work for both organizations. And partner, as far as partner, anybody that wants to partner with us as far as employment, if anybody's looking for employment, we don't, we'll engage with any employer who's looking for staff. If we can match anybody that is looking for staff, and we have somebody that in mind that is looking for employment, we'll definitely match them up. Or else we'll take the information, we'll share that information on our social media platforms, try to get interest in those positions. But either way, with our employers, we'd like to go out to the sites to make sure that it's somebody that is going to treat our referrals, fairly, and make sure that we're not referring somebody to an employer that will not, treat our referrals as they should be treated. So that's an important piece of what we do too, making sure that who we work with is important. It's important to make sure that our referrals are going to be treated right.
One of the things you talked about was retention support, and the fact that in some of these instances, you spend time working with people who've gone through the programs for up to a year after they've left. How important is that?
It's very important. I mean, I'm going to let my staff, if anybody wants to answer, you can jump in. I'm just feel like, it's important. I mean, I think we've seen it. We have students that come in after they've graduated and or just maybe switching positions, coming in for advice as to how to navigate that. Just maybe some are looking for a different direction to go in. Some have just really want to come back and engage in our services. If they were taking ESL, maybe had to take a break because of something going on, they'll come back in. Case management allows us to be able to have those conversations and know what's going on. So if we can offer assistance, if they need help navigating anything, as far as workforce, as far as even any kind of life situations, we'll know about it because we maintain contact with our students and our graduates.
Some of the programs, the health programs in particular, talked about the requirement that the individual have health insurance. Is that a challenge, and how do you deal with that?
Excuse me, Dave, can you repeat the question?
Sure. Some of the programs that were mentioned, I think particularly in the health field, talked about the requirement that the individual have health insurance.
Yeah.
Is that a challenge for the people coming through the program? And if so, how do you help with that?
Well, it is a challenge. We haven't seen it as a big challenge, but we have some students that don't have insurance. We ask them about, their employment status, if they're working, if there's no opportunity for them to gain insurance through an employment. We also make sure that if there's an opportunity for them to apply for state assistance, that they do that and refer them there. But it is a challenge for some individuals who are working and do not have enough they don't offer them insurance through their employment because they may be part-time, maybe less than the hours required, but they also make too much to maybe qualify for the state insurance. So again, navigating that piece of it is difficult, but most of the students that have come through our allied health program, especially during COVID, have had, following COVID, have had insurance.
Okay. How does somebody enroll in the program? How do they find out what you're offering and sign up for something if they need it?
They can give us a call at 484-513-3348. They can come in our offices at 450 South 6th Street, and our office hours are from 8:30 to 5. Or they can go onto our website and they can sign up for our services there. Our website is www.blwdc.org. And those are the means. They can reach out to us on Facebook. We're very active on Facebook. If they want to just send us a message on Facebook, we'll reach out to them. And so, yeah, those are the means of contacting us at Tech Central. We welcome anybody that wants to come through our doors. If they want to come in for a tour who have not been here, they just want to see our space. Yeah, they're welcome to visit us at 450 South 6th Street.
And one final question. It seems like there is more demand for the programs than what you're able to meet right now. The ESL program, significant waiting list. Some of the other programs, it seems like there's some demand for them as well. The culinary arts program and all the healthcare related programs, I think, are going to be demand for them. What can people do to help you grow your capacity to serve these people?
To continue to grow, I think what we're doing now is really reaching out to other organizations that we know will be beneficial for our students. Of course, financially, we have to secure funding to be able to offer the programs. And so that's one piece of it that we're navigating, but also the importance of others, other organizations that, first of all, like the Literacy Council, who we work with our ESL, just like RAC, who handles our allied health programs. And as we will be doing within the future with our trades programs, is working with employers in the area to see what their needs are and how we can work together to get our students employed. So really it's about once we train our participants so that they are ready, willing, and able to go to work, that we have employers that we can hand them off to and make sure that they are going to make a wage that is sustainable. So I think that really is the assistance that we need, is to make sure that, we want to make sure that our graduates contribute to our community and are able to earn a wage that's sustainable. So I hope I answered that question.
No, you did. That was fine.
Okay.
It is amazing to think about what you've been able to accomplish in a very short period of time and the potential that you're going to have to impact this community. I want to thank you and your team. It was a terrific job today. You guys did a great job, and you're doing great and very important work. So thank you very, very much. And thank you, everybody, for joining us.
Thank you, Dave.
Thank you.
Thank you.
Thank you.